Hello, good morning or good afternoon. Thank you so much for joining us today. My name is Frida Pineda Sandoval, and I am the Training and Technical Assistance Manager for NCHPH. So I would like to welcome you to today's webinar on academic partnerships to foster multidirectional learning and reinforce our health center workforce webinar. This is brought to you by the National Center for Health and Public Housing. And before we get started, I'm just going to go over a few housekeeping items. This is just a reminder to everybody that all participants are muted upon entry. Please make sure that you also engage in the chat if you have any questions or any comments or any promising practices that you would like to share with us today related to today's topic. Also make sure that you raise your hand if you would like to unmute during our Q&A session. This meeting is also being recorded, and the slides and recording link will be sent via email to all participants after today's session. Before we also get started, a little bit about our organization. The National Center for Health and Public Housing has the mission to strengthen the capacity of public housing primary care grantees and other health center grantees by providing training and a range of technical assistance. And NCHPH is a project supported by the Health Resources and Services Administration and is a national training and technical assistance partner and is 100% financed by this grant. The information presented today are those of the author only as well. All right, and now we'll pass it on to Dr. Jose Leon, who will go over our learning objectives for today.
Thank you, Fide. Good afternoon, everyone, or good morning, depending on where you are in the country. Today, we are going to identify the challenges to recruit and retain health center staff, have a discussion on how partnerships with academic institutions help to recruit, train, and retain the health center workforce. And we are going to review how partnerships with academic institutions serve as a conduit to enhance population health. Next slide, please. In case you are not familiar with the Public Housing Primary Care Program, the Public Housing Primary Care Program, or PHPC, is a HRSA program providing services to public housing residents and those living close to or immediately accessible to the public housing developments. According to HRSA, in 2021, 458 health centers reported to be immediately accessible to public housing, and they serve 5.7 million patients. 108 of these health centers receive funds from HRSA to provide these services to this special population, and in the same year, they provided services to over 900,000 patients. Next slide, please. Following with some characteristics of those living in public housing. According to HUD, and this is the most recent data that we have from HUD, this is 2022 data, 1.5 million people live in public housing developments. The average per household is 2 people. 38% of those living in public housing report to have at least one disability. 52% are white, 43% are African American, 26% are Latino. There is a large population of people or seniors over the age of 65, 19%. And 36% of the household report to have one or more children with who are at 17 years of age or younger. 32% are female-headed, and it's interesting to highlight that 91% of those living in public housing are low-income populations. Next slide, please. It's an honor to have today Dr. Zara Marcelian, who is the founder and president and CEO of La Maestra Family Clinic Health Center that serves approximately 45,000 individuals in San Diego County every year. Zara is an award-winning author, a well-regarded speaker, and an international consultant. Dr. Marcellian also serves on numerous advisory boards, and for more than 36 years, Zara has developed programs and services that meet the community's need. Zara developed a holistic solution-based model to address overall health and well-being for all patients, regardless of their ability to pay. The model, known as La Maestra Circle of Care, provides primary and specialty healthcare and social services to address the social determinants of health. In San Diego, California, the services include an on-site food pantry, housing, microcredit, and micro-enterprise programs, job training programs, after-school and summer programs, outreach, health education, environmental health, case management, and public program application assistance. Also, before the webinar, Dr. Marcellian was telling me that they are celebrating the 33rd anniversary of La Maestra. So congratulations and welcome, Dr. Marcellian.
Thank you so much, Dr. Leon. It's always a pleasure to be part of these webinars that I think could really help by providing ideas, best practices for others to think how it would fit within their health centers. So I hope that's what we can do again today. Thank you so much. Are we ready for the presentation? Perfect. So this is La Maestra's flagship building there in City Heights in San Diego. That's basically our first location. Didn't look like that. We used to be in like 10 old residences that had been converted to health centers, and we were there until 2010 is when we were able to build this 3-story Gold LEED certified health center. So I use this picture on everything. I'm just so proud of it. Next frame, please. This gives you an idea of the model that Dr. Leon was referring to. We've been working on for many years. It's called La Maestra's Circle of Care. And what it means is it's a holistic integrated model that brings in the social determinants needs that patients will have and blend it into the primary care and specialty care services that we offer at La Maestra. So you'll see, for example, the red is all medical, dental, mental health, imaging, and all the comprehensive medical services. Then you get over to the green, and the green is going to be job training, microcredit, micro-enterprise, environmental health programs. We also have, like Dr. Leon was referring to, we have transitional housing for reentry populations. We have those services specifically helping victims recover and help them in every way we can. So we have a human trafficking assistance program, and we have an immigration assistance program as well. And now we're branching into family law. Why did we develop all of these services, including the food pantry, the after-school program for children? It's like a youth development program, and all of those others in these different sectors is because that's what the patients presented as needing. That's what they talked about. That's what they said impacted their lives. And we can see that if, for example, you're dealing with victims of human trafficking, they have small children, they've been living in their car for 2 years, and you as the provider are trying to help with the child's asthma, right? This chronic condition that keeps presenting itself, and the triggers, and they keep going to the emergency room. You finally find out they've been living in their car. That's an important piece to understand and to try to address by referring them to perhaps housing for single parents, low-income housing. I mean, it alerts the provider that there's other issues going on that are impacting the patient's health and well-being. And that's what this circle of care has developed into. And I imagine we will keep adding as we go. Next page, please. The number that we have now, you can see the unduplicated patients to date since January with the visits. We are almost back to, I would say, pre-COVID productivity in most of our service units, with the exception of, you know, some that seem to be a little slower. And primarily it has to do with providers in the behavioral health, mental health sector specifically, that want to continue with the telehealth and remote counseling as much as possible. So that's something post-COVID. As we emerge from COVID, that's one of the challenges, and it does have to do with the workforce, right? Our last seminar or webinar we covered were, you know, some of the other issues that, you know, health centers are facing around workforce retention, workforce challenges in general. And that's one. We have a lot of staff that was doing very well in the telehealth, remote visits during COVID, and now they want to continue that. So we're working more towards a hybrid approach. So another unique feature about La Maestra is that we have staff and patients that speak more than 55 languages and dialects. So we have 850 staff currently, and we have 21 sites in 4 San Diego communities: City Heights, El Cajon, National City, Lemon Grove. We're also in schools. We have school-based health, and we have licensed mobile clinics. Next page. So this webinar is about, you know, recruitment and retention. And I know that the second part of this webinar, which will be later on in this month, will focus a lot on how do you retain, what are some good ideas and practices to retain your workforce. So this here is provider recruitment trends. If we look at the 110 providers that we currently have, 50% were recruited from our own providers' networks. So who they know, who they hang out with, who they studied with, who they network with, who they are working on, you know, special research projects with, whatever their focus of interest is, our providers will have a group of like cohorts or colleagues that they interact with, and that's a wonderful way for us to build that into our recruitment models. It seems to work. 30% are from partner academic programs, which we will cover here in this presentation, and 20% are through our recruitment websites. We also belong to consortia, local, state, and national. And sometimes that is very helpful as well to post the different job opportunities on the consortia job boards. Next slide. These are some challenges that we noted I mean, it's still occurring, right? The trends that we're seeing in terms of challenges for recruitment and retention, there's always competition from hospitals, even pre-COVID. You know, they're always increasing the rates. They're making their positions, their job positions sound, you know, very, very alluring. And it's something to reckon with. So we obviously cannot pay the providers, the nurses, you know, the same range that hospitals do, because after all, like nurses are not doing the same work as they are in the hospital when they're at the health center. One is inpatient and one is not. It's outpatient. So not to say that one is easier or not, it's just the skills that are required and the pay skills that go along with that. But it's a constant challenge. Again, after COVID, we noticed there were some staff that were working remotely during COVID that moved to other cities and states without notifying us that they had moved. And so this resulted obviously in, you know, a scrambling around, okay, what are the legal issues when you have a provider that no longer is working from San Diego? That's where we are, but they're now in Texas, for example. What are the workman's comp insurance requirements that are different? What about that state's payroll tax requirements? It's just, our malpractice carrier needs to know about it. And so that was something that we hadn't anticipated. So we then began to do a periodic check of the login locations to see where staff are logging in from. And that was something that, our risk and compliance folks took over and help us monitor as we continue having providers in this hybrid program where they can, work remotely depending on the services, right? We also saw other challenges during these past few years, the Great Resignation in 2021, during COVID, quiet quitting in 2022, where, the staff sometimes are not very engaged and you see minimal performance effort from them. Career cushioning in 2022-23, constantly tracking other job opportunities while at the present job. So that's another trend that we've been seeing. Quiet hiring, where this is recently where managers are tasking their star employees to do additional duties instead of hiring additional staff. So you see more staff wearing, more additional hats. Some staff really welcome that. They love to be challenged. Others, it is not, it's not something that they're happy with. So I think all of these trends are important to note and to think, gee, is that happening in our health center? How would I know that? What does our HR say about that? What can we do to mitigate the negative consequences from this? And how do you keep all of this in mind as you're working with the whole recruitment and retention? So reorganization of staff post-COVID and reworking pathways, that's important. Change is always important, but it does take a toll on some of the long-term staff that have been tasked with numerous jobs. Next slide, please. Some current employee stressors that we've noticed and also are apparent here through these journal and professional publications. According to APA, American Psychological Association, 3 out of 6 employees reported work-related stress post-COVID. And so from an HR perspective, we have to be conscious about this and also, this factor and what could we do? Can we continue on, for example, at La Maestra, offering free mental health visits for our employees for coping, resiliency, skills, support groups, and so forth, should they want to, participate in that, in those resources. 87% of Americans are anxious about the inflation, and that continues. So that means that the employees are going to be constantly thinking, okay, I'm stressed. I feel like I'm just, surviving right now, not thriving as we're coming out of COVID. And I know that everything costs more money. So should I go and ask for more money from my employer to keep up with those rising costs that I'm faced every day? So this is, 7 out of 10 employees are worried that their pay is not going to be sufficient to keep up with the rising inflation. Something else to be concerned about. Next slide. The other trend that we've seen, and it's important to note, like who all is, what age is usually applying for our positions. Aside from the providers, we see that 50% of the workforce in 2020 were millennials. And the study that I provided here a link to shows some very important features. 64% of millennials want to work with organizations based on the company's social and environmental commitments. So they will spend time looking up about the organization, what the commitment is, what has the organization done so far towards social impact social justice, environmental, health initiatives, and so forth. And it says that 64% will not accept offers of employment if the company does not demonstrate a strong corporate social responsibility values. And why is that? Because this age group seems to really want, it's super important to them to feel like they are going to work at an organization that is having some positive impact, and they want to be part of that positive impact. And that is something to remember when we are recruiting new applicants that are millennials. And in any way, we work it into our orientation and our training about, what does La Maestra do? What have we done over the last 33 years as a FQHC? And before that, we had another, 4 years as an educational center. So that totals 6 years, 7 years. And what impact is like, so what have we done? And, the numbers are great. Individual case stories are fantastic. If you've done any research, any qualitative case studies, those are really important to share with your new hires for them to understand, hey, this is really what the organization is about. And it welcomes people that are like-minded, that have similar passions to join and be part of this huge effort. And that is a very good point there. So 88% want to be engaged in organizations that have that positive impact on social and environmental issues. So wanted to keep that in mind. Next page. The other important piece is that employees really do want to feel like they belong, like they're included, like they fit. And the organization from the admin side wants to make sure that that employee is a good fit for the organization as well. In fact, there's a lot of theories around organizational fits. So this is something that people will be looking for, like, what does the organization feel like? And they're going to pick up on this through your website, your social media, whatever they've heard from other, contacts that they have that have worked with the organization, or perhaps they're coming from some partner organization that you've done, joint outreach or health fairs or some kind of other community event with. So to reflect the organization's values and the purpose, the mission, and what has the organization been able to achieve should be available for potential employees and those that you hire, the new hires, to go over and have that information in front of them so they can see, yes, I do fit. This is an organization that I would feel good being part of. The organizational culture feels good. It feels similar to, to what's important to me. The composition of cultures there seems to resonate with me. It intrigues me. I feel good spending my time here. That's really what you want people to feel. And of course, are the values reflected in the organization's policies and practices and behaviors that your new recruits are going to be seeing when they go through all of the onboarding HR policies and procedures. They're going to see, okay, well, so this is what they say. Is it backed up with any policy? Is it, has it been passed through the board? Is this really important to the organization to identify, develop, and implement environmental health initiatives? So that's just an example. Employee wellness programs is another, I guess, good feature that we offer for our employees. Special benefits, the mental health coping visits, and also support, a lot of supportive services and groups that we have for our employees to help them as we emerge from COVID and figure out, okay, so what's ahead of us now? What do we want to do? Is there a place for what we want to do in the future still here at La Maestra? So let's say we go get another, another certification, or we go from being, an MA to an LVN. Will there be a position at La Maestra for us still as we continue to, access this career ladder? We want to make sure to give them all of that information so that they know that they do have a future with us. We want to retain good people. Next slide. So the recruitment opportunities I wanted to cover today is with our academic institutions. That includes our universities, our community college programs. We have pilot programs also that will come up every once in a while. So if we have partnerships with these different academic institutions, they would then let us know, hey, there's a new pilot out, for example, one that we had was called Welcome Back. And it was with one of our local community colleges, and it had a special designation from the state, like, yes, we need more providers. This was about foreign providers that wanted to, study to become nurses. Okay, so let's say they didn't want to pass their bars, they weren't ready, they didn't have the English proficiency, they wanted to go into this advanced nursing program. So instead of taking 2 years, it took them 1 year. And part of the requirement was for them to work in a community health center or, a nonprofit in communities that were underserved medically. So La Maestra was a partner there, and it was great. I mean, we were able to get providers that had been physicians, let's say in Peru and Mexico, and then they came through this nursing program, and they've since gone on to be nurse practitioners. So it's great that they were able to retain that incredible training and experience from their country and bring it here, where we do need additional providers that are culturally competent. So that's an example. The National Health Service Program, we will talk about state loan repayment programs. And the lessons that we've learned along this journey that I wanted to share was the importance really of developing an MOU with the affiliate. So with the academic institution, university, the vocational training schools, whoever. It's really important to make sure in that MOU you have like liability. Who's covering the liability? Who's going to supervise those students? If they expect the health center staff to do that, how many hours is that going to take away from your staff time? What kind of documentation is your staff going to have to maintain with these students? What happens when the student is not a fit in the program, or is having some major, disruptive issues? What are the recourses for the, in this contract or MOU for the health center to move past that? So this is just all important to have these features in your MOU and be aware of that. And then internally, like, who is going to be the lead staff to manage these students in each department? And who's going to supervise the students, and again about the insurance and liability issues to do the risk mitigation right up front. It's a good idea to pay attention to this MOU. Next slide. So let's say you have a group of students, and what can you do to let those students know and encourage them, those that feel like the organization is a fit? What could you do to encourage these students to look for employment at La Maestra after, or your health center, obviously, after they finish their training? So we have a great effort between our HR and the lead staff, are usually our CMO and other medical directors, that are keeping an eye on these students that are with us. And they make recommendations, staff will make recommendations about students that seem to fit in really well, be happy at our health center. And then, they're approached about, what would you feel like working here? Would you be, are you thinking of settling in San Diego? Or, what was your dream? And would you see yourself fitting in this organization and aligning with our populations that we serve? And then that progresses to making those offers of employment to the students selected before they graduate. So it's not like, okay, they graduate and then we approach them. No, we talk to them before they graduate to see, okay, look, we've spoken about how well you fit, how much you like it. This really is aligning with your purpose, your passion in life, and we'd like to make you this offer. That works really well. By then, they've already built trusted relationships. They like the network at the clinic, the other providers, the environment. They've met a lot of the other staff. They see what appeals to them in terms of unique features about La Maestra. And so we take all of that into consideration and we present it as a package then for them to consider so we can keep them after they graduate. So post-recruitment, what do? We appoint mentor providers for new hires from the student pool. And we develop onboarding, training, supervision schedule. We do a constant evaluation and feedback, and what care teams these new hires will go to and belong to. So that's not like they're out there floating on their own. They have a mentor, they have a care team, and it's really setting people up to succeed. Next slide. The recruitment partnerships, we start with obviously developing our own talent management program that's through our HR. And then our program starts with the recruitment, orientation, training, evaluation, career counseling for retention, advancement, certifications, as they align with people who are already working with us, with their career vision, with their aspirations. So again, as they climb their career ladder, they can see themselves remaining with La Maestra. So then we go to the in-house career center for retention and advancement. This we will cover in webinar 2 more fully. We offer robust employee benefits and competitive pay rates, obviously not with the hospitals, but with other health centers. We have in-house residency programs. We collaborate with vocational training schools. That will be also in webinar 2. We have established in-house training programs of our own, and always looking for and developing pilot programs with local colleges, universities, like the example I shared called Welcome Back program. The next is explore J1 visa programs and other immigration options for foreign providers. Now we're on the border, and yes, we have a lot of Spanish speaking patients. Well, we also, as you see in the beginning of this webinar, have many other languages. Now, does that mean that we're going to go after providers that are from those language bases? Not necessarily. It's who brings the competency, and then we can always sustain that with our cultural liaison model, which is bringing medically trained staff who already are our staff, and we access them for medical interpretation after they go through training, and then they get certified. So it's all part of a team. It's impossible for one provider to be speaking all these languages, obviously. So we have to put that team together. Teaching health center, graduate medical education accreditation, we'll be covering that. The Nurse Corps Scholarship and Loan Repayment Program, as well as the National Health Service Corps. Next slide. These are some of the academic affiliations with La Maestra. Family medicine residency program, internal medicine, pediatrics, family practice, osteopathic medicine, naturopathic medical student residency program, physician assistant, nurse practitioner, schools of nursing, dental residency, pharmacy residency, clinical psychology residency programs, substance use disorder counseling residents, those are the SUDs, MFT and LCSW programs. Now, we don't have all of these built in-house. We started with just doing the affiliations, the MOUs with all of these programs in our area and even outside of San Diego, as you'll see with our dental residents and our medical residents coming from Northern California. So, and then it just grows. And with us, it was like, okay, so now we have this opportunity to explore dental, in-house dental residency program with this partner, that partner, Rady's Children's Hospital, whatever, and the funding aligns, and then we're able to start something. So that's how the flow has been, but we've always wanted to develop more in-house. And so when the timing is right, which is now, by the way, with many of these residency and programs through academic affiliations. Next slide, please. So the Teaching Health Center, GME La Maestra, was awarded a planning grant. This was awesome in October 2021 through DHHS to establish an accredited community-based primary care residency program in family medicine. This is thrilling. We were really just so happy to get this. The goal is to expand our primary care physician workforce in underserved communities in San Diego. So this speaks to, okay, how are we going to keep recruiting and finding new providers when, as we know, the number of providers at community health centers continues to drop in terms of availability. There's less going to medical school, on and on and on. Projected accreditation, we hope by November 2023 through the Accreditation Council for Graduate Medical Education. And we hope to host our first group of residents by July 2025. And our residents will be fully versed, not just in family medicine, but in La Maestra Circle of Care, which is that whole holistic model that incorporates and integrates different practices, care teams, as well as social determinants. And there's an article there for you to access at the bottom as well around the Teaching Health Center opportunities. Next slide. Behavioral health and mental health affiliation. We have on-site mental health and substance use disorder services through our SUDS programs. We have nursing and health science through our University of San Diego Doctor of Nursing program, psychiatric mental health nurse practitioners. And then here locally, well, not really locally, but California State University, San Marcos, Masters of Science in Nursing. These are psychiatric mental health nurse practitioners. Locally, we do have the Alliant International University for clinical counseling, clinical psychology, marital and family therapy, marital and family therapy, the MAs or the PSYDs. And then we obviously work very closely with all of the treatment centers, and we have good affiliations with them, which complement what the students want to do when they come out at a site. They want to be in the community. They want to be experiencing firsthand working with people with behavioral and mental health issues, and that a lot of times will involve treatment centers and group homes, and that brings in all of the other networks and partners that are involved in providing the care. Next slide. Okay, this is for the dental affiliations. We have our own pediatric dental residency site through a partnership with Rady's Children's Hospital. This was in 2000, 2010. We had about 4 dental residents per year. So not a lot, but it gave us that opportunity to build a strong foundation, learn from the best, and then keep looking for other opportunities to bring more of these programs in-house and continue it on. We also had affiliation with the University California, San Marcos. It was a pipeline program, which was 5 dental residents per year. Now, keep in mind, these residents, they're already dentists. So they really were able to help us with, as we were rolling out new dental sites and with productivity and getting people in the door, access at our school sites as well, on our dental mobile clinics. Then for another example, residents from the New York University Langone Hospital's General Dentistry Residency Program, that gave us 5 dental residents per year. And then we were able to apply for our own CODA, which is the Commission on Dental Accreditation in 2022. This will help us greatly. Once accredited, we can have like 7 more sites we can fill with residents. And that is just awesome. Our experience with these programs, especially around dental, has been really good. We have people that, dentists that come to us, residents that really do fit in with our communities and our cultures, and they want to stay with us when they get finished. So that's great. Then we have a new implant program through the University of Nevada, and we hope to get 7 dental residents by June 2025. So that's important to note, like what else is coming, what's the future of dentistry, just like what's the future of mental health and what's the future of family practice, for example. All of those disciplines, like what's happening within those disciplines. Is there going to be a shortage? What can we do to build best practices around recruiting for those disciplines, so we're not stuck here in 2 years, with a big gap in provider coverage. Next slide. The National Health Service Corps, I'm sure you've already heard about the updates on that. It's great. You have the NHSC loan repayment program. You have the SUD workforce repayment program. You have the rural community loan repayment program. And the disciplines for all the programs under NHSC is for, you can see, physicians, nurse practitioners, physician's assistants, certified nurse midwives, health service psychologists, licensed clinical social workers, psychiatric nurse specialists, the MFTs, and the licensed professional counselors. And then you can go down and see on this website, I provided you the link for, the eligible disciplines for specific programs. So if you're in, for example, the rural area, designated areas, then you would have, you have more opportunities here for some of these other disciplines to participate and be able to obtain, the scholarships and the loan repayment programs. Next slide. So my advice here is look up your HPSA scores, and if you are in a medically underserved area or medically underserved provider area designation, here's a link for it. It'll tell you the list shortage for all of these different areas that, providers that health centers are always looking for. And then those health professionals interested in applying for scholarships, that's another link. So my advice for looking up the MUA and the MUPA designations, do not be discouraged if you see that your health center is not, for example, in a medically underserved provider area. We had that happen in one of our sites, at one of our sites that we knew darn well for dental. It said, the website said that we're not in a medically underserved provider area. So what did we do? We went around and saw, okay, who's there? There was a lot of private dentists. Sometimes one dentist in this private office would not accept our patient populations because of language barriers. And really, even if he did, how many could he serve, right? So we had to make the case, and we continuously do in our grants and applications that, look, this is a site over here that doesn't show as a MUPA, but it is because of the following rationale. So we got, patient testimonies saying they tried to go there, they couldn't get in, and just, present the case as it is. So sometimes you can get some kind of leverage there. All of this is according to your, what geographic areas you're in, the populations you serve. And if you are a 330 funded health center, then by virtue of that, you qualify to participate in the, the HIPSA and the National Health Service Corps. The other point I wanted to mention was the J1 visa program. When we're looking for more providers and how to look at this from a diverse perspective. So look at the schools and who you can recruit and what students you can encourage to stay with you. What about looking at foreign providers? Next slide. These are some options for foreign physicians. Now, we don't have the time to go through all of these here, but just the F1 student visa, most foreign medical residents are studying in programs on a student visa. That's a F1 student visa, and they obtain this through their medical schools. After they're finished, then there are other options for them to continue. So you have those that are already in medical schools in the United States on student visas that could then transition into some of these other applications under immigration options for foreign physicians. And we've tried to bring some of these here for you. You can look at this. Hopefully we'll be able to offer a webinar on more of these options and who you can work with that could help do those immigration applications for your health center. This is a J1 exchange visitor visa. That's awesome. You can pursue residency, fellowship training in the United States, and it goes for 7 years. So, and then what do you do beyond that? Then you go to the H-1B. Next page, please. And each one of these is hyperlinked. So if you want to know more about it, all you have to do is hit the title there and it'll take you right to more information. So this is the H-1B specialty occupation visa. So we have had also providers on this visa. Works very well. The next one is the O1 visa for individuals with extraordinary ability or achievement. It's less common, but it is definitely an option for physicians who want to stay in the United States working at your health center for an indefinite period of time. So you can go ahead and read on that there. Again, each one of these options, immigration options, has a link there for you to explore and think, okay, so, who is your patient base and how would foreign providers fit into your needs and to your projected growth as the health center moves forward, and moreover, like what skills, what training do they have that makes them great candidates for your programs and for your services. So that's definitely something to explore. And the next slide. Great. So I would just say that, again, when we try to look for viable options or viable pathways to have more recruitment resources, it's not, one road isn't going to just take us there. We have to look at many or numerous pathways to keep residents, recruitment flowing into our health center. And then what do we do to keep people and to make them feel included and that they belong and that they can continue their career ladder, they can continue their career development while remaining at the health center, bringing back those tools that they obtain and the resources back to the health center. And then we all grow together. Thank you so much for that, for your time. And I hope that some of this information has proven useful to you and can spark some ideas of what you can do at your health center around, the workforce issues we're all facing. Thank you.
Thank you, Dr. Marcellian. Thank you so much for all the great information that you provided today. We have a few minutes for a Q&A session. So if you have a question for Dr. Marcellian, please type your question. There is a Q&A box. You can also use the chat, or if you would like to ask a question verbally, you can use the raise hand icon at the bottom of your screen and your line will be unmuted. In the meantime, please do not forget to complete this survey after this webinar. Your information is very valuable for all of us. So please complete the survey after the webinar is over. So any additional questions regarding this webinar, Dr. Marcellian mentioned that some of the slides have links. So all the slides and the recording will be sent to all participants in the next few days. Also, you can go to our website, www.nchph.org, and you will find the slides, the recording, and you will be able to download the slides as well. However, all the slides and the recording link will be sent to all of you in the next few days. So let's see. I don't see any questions so far. But I would like to ask you a question, Dr. Marcellian, and this is regarding how often do you assess the need for all your staff? You know, I mean, the healthcare environment is always changing, and COVID was a big concern, and we have been discussing with you burnout. We've been discussing with you that all these workforce issues started even before COVID, and it's the primary care is always changing. There was right now there is a need of behavioral health specialists because all the behavioral and mental health issues. In the future, probably there will be a need of people who are more experienced or have more experience working with seniors. You know, that because our population is aging. So how do you do? How often do you assess these needs and then come together as a group with your providers and your CMO and your HR director and say, hey, this is what we are going to need in the future?
Well, that's a great question. Again, it's how do you keep pulse, not just on who you're serving, because that can change, right? You get different populations moving into your areas, subpopulations, like with us, with the Afghan refugees and the Ukrainians, and just on and on, depending on what's happening there in the world, right? But also, how are the needs of your workforce changing as we emerge from COVID? And we hear about that from different groups. So we have a management team that meets every 2 weeks virtually, and they represent all of the sectors of the programs that we work in. So for example, you will have medical directors there. You will also have directors from our social determinants programs there. And so they address emerging issues, possible solutions, strategies that we can implement, and what should we be keeping an eye on. And one topic each time is about workforce issues and challenges and how we're going to be meeting those. So it takes all of the brains from all of the different service units that are all concentrating on this and coming up with good solutions and diverse solutions, not just one solution. So that's one area. The other is HR, constantly in HR, and they keep track of this. And we do surveys with our staff as well, regular surveys. What issues are you experiencing? What could we help you with looking into? Doesn't mean we're going to solve everybody's problem, but what are some of the topics that are continue to remain an issue and challenge for you and your family? And we know one is childcare, the other is housing. I mean, those are, and that feedback, what do we do with? Well, then we continue to work finding more resources for our staff. So it's just like we do for the social determinants needs of our patients. We also have social determinants needs for our staff. And that's super important, is to have those resources. A lot of times, even staff, they don't know, where to go, where to search, what to look under, that others have found themselves in these similar situations. So whatever resources we can assemble, that's great too. And we have a great, employee handbook, resource materials. And again, it's keeping a pulse and having that relationship with the staff, so they feel like they can talk to their supervisor, they can talk to their colleagues, right? About, gosh, this is what I'm going through, and what do you guys suggest? And do you have any suggestions? Does HR have any suggestions? Does the medical director have any suggestions? So it just, that's kind of that supportive network, I think, that a lot of our health centers have become for the employees during the crisis of COVID. And as we emerge and, and prepare for the future, we continue to be a supportive network for our staff.
Thank you so much for that. Fide, do you see any questions?
No questions at this time.
All right, so again, next slide, Fide. Thank you so much for attending this webinar. It's been a pleasure to have Dr. Marcelian with us. She is always very, very happy and willing to participate and provide her expertise with all of us. Again, please complete the post-evaluation survey after this webinar is over. And the next slide, if you have any questions, or if you say, oh, I forgot to ask this question, please feel free to contact any of our staff members, and we are going to make sure that Dr. Marcelian receives any questions from any of you. If you have any additional questions, thank you so much for your time, and have a great afternoon. Thank you, Dr. Marcelian.
Thank you. Thank you so much, Dr. Leon.
Bye.
Bye-bye.